I think one of the things from 2023 that really I'm proud of right now is kind of the reinvestment in the behavioral health, very specifically mental health space. One of the biggest challenges in this area is stigma. Look, we have a lot of folks who are embarrassed, ashamed, and of course, they should be neither of the above. But I think we're doing a really good job pushing back on stigma and encouraging people to come forward and encouraging people to say the three most difficult words for any human being to say: I need help. There's been millions upon millions of dollars in investments this past year in 2023, and much of those investments have been targeted at the workforce to encourage people to come into the workforce, but also people who are in the workforce to encourage them to stay. The numbers, you can talk about any number of the biggest challenges in the Commonwealth, the emergency department boarding that's going on. And many of them are being driven by just the lack of workforce in this area. So you can talk all you want about beds, right? Like mental health, behavioral health beds. But if you don't have people to staff them, they're not beds that are available. And I've gotten to a point now where I have conversations with providers and they'll say, we expect to have this many beds online, or we have this many beds online. And before they even finish their sentence, I say, how many beds can you staff though? That's the only number that I'm interested in here. We're making progress in that. More people are going into it, but we've got a lot of work to do, because saying more people are going into behavioral health is, you really need to quantify that, because there's such a dearth, and there's just such low numbers. We need to continue to do it. And look, this session's not done, right? This is year one of a 2-year legislative session, and I fully expect recent conversation with my leadership about drafting an SUD bill, a substance use disorder bill, which the numbers from overdoses came out a month ago, and they're just as high. They're marginally less, 2 or 3 people less. So in 2022, 2,357 people died of a drug overdose. The preliminary data from 2023, and I want to stress preliminary, so it could be lower, it could be higher, was a couple lower than that. I think 2,352 to maybe 53, but too high. And fentanyl's present in 93% of it. So we still find ourselves in this battle of a lifetime. And it's something that I live pretty daily in terms of trying to help people navigate the system, get the services they need, trying to get insurances to cover. And it's a daily grind. So a lot of good work accomplished in 2023 in the behavioral health space, specifically in the workforce side. But to say that we can kind of sit down and rest on our laurels would be just a gross and inaccurate statement. There is so much work to do. People are hurting, people are dying, but certainly steps in the right direction. One of the positive things, and again, I'm going to end this topic where I kind of began. One of the really cool things out there is that, and don't get me wrong, stigma is still absolutely pronounced and profound in this space, but we are seeing a willingness. I love going into a school when I'll talk to a young man or a young woman in high school, and they'll raise their hand, and they'll say, many of them without hesitation, I'm struggling with anxiety, I'm struggling with depression. Some will say suicidal ideations, and the notion that something like that would even been even thinkable 5 years ago, 7 years ago, is just not my experience. So I think that's really, really good, right? It's not dealing with the underlying problem. Why are kids more anxious? Why are they more depressed? Why are there more suicidal ideations? But the first step to getting help is admitting that there's a challenge there. So I'm cautiously optimistic in that space. But again, you can't rest on your laurels. And then look, it's been a big year. We've passed tax reform. Massachusetts right now, one of the biggest challenges we have is housing, and again, just the affordability of this state. And one of the things that I would frequently tell people is, like, every policy that we make you need to look at it through the lens of, does this make Massachusetts more or less competitive? Because the reality is, especially post COVID, when remote work is here to stay, there's a lot of states who are trying to build up industries that Massachusetts historically has excelled at and still excel at. But if for example, Tennessee, to choose one of the states that a lot of people are going to, if they can offer certain incentives, tax incentives, and their housing costs are significantly less in the day and age of remote work, what's to prevent someone from going to work down there and
Mhm.
work down there, live down there rather, and work in Massachusetts? And so there's all these issues that are out there as far as the competitiveness of Massachusetts, and every issue we take up, quality of living, wages, housing, access to behavioral health treatment. To me, that's all part of the, is Massachusetts competitive? Because, if someone isn't happy here or can't afford here or is not having whatever their needs are met, they will look elsewhere. People will leave. And we've seen that here in Massachusetts. So the housing, the competitiveness, just the other day, we had the housing bond bill, the governor's housing bond bill. One of the biggest things that we need to get done this year in 2024 is, taking a monumental billion dollar plus step in the housing field. Housing is, I would argue, the biggest challenge we have here, because if you can't afford to live here, you're not going to live here, and you're going to leave here if you can't live. So, and again, it runs the gamut, right? The cost of housing, the cost of rent, it's everything. This isn't a problem unique to one socioeconomic status. You know, people are people are hurting right now,
Yeah,
and
to your point, Senator, the if people are not living here and they're working remote from another state, their taxes are not coming here. Their taxes are going where they live, where they own their property,
absolutely.
where they spend their money. The sales tax goes there. It's in this age of technology where it's as you just said, even just finding an apartment to rent is very challenging.
Very challenging.
People positions are going unfilled. Some places cannot afford to pay more to their employees beyond the minimum wage because then they would have to shut down. The mom and pop stores. I mean, how can you impose on them to, oh, you got to pay them, whatever, $20 an hour? They're working, the mom and the pop, in that shop 6 days a week with their children, or with friends.
Yeah.
So it's just like the economy. I understand. Oh, the inflation seems to be slowing down, and really, Senator, I'm not even sure what that means because, as far as I know, everything's still very expensive. Um, and most people are still struggling. Most people are still
Well,
struggling.
yeah, I have to say this just because I think it's so important. Like, to me, you know, in my experience, and again, this is just my experience, one of the best ways to get the real pulse of people about their opinion on the state of the economy and all that stuff is, like, the overwhelming majority of people don't invest in stocks. They don't have the
Right.
resources to do that. So one of the best indicators to me is, are you happy or upset with what your grocery bill is, what your grocery receipt says? Like, to me, that is where inflation is tried and tested the most. To your point, I read an article on this the other day, because that's been my experience and my wife's experience, right? Like, we're hearing these numbers that inflation is going down, and yet we're going to the grocery store and other places, and the prices seem astronomically high. And I set off one day this week to try to, like, figure that out. And it's, inflation is going down, but they're going down from record high levels. So what you're seeing is, yeah, it's definitely going down. That is a technically true statement, but it's from record high levels. So the notion that, you can with a straight face say, I'm enacting these policies that are causing inflation to go down. Yeah, well, technically true, sure. But from the consumer standpoint, the person that's going to the grocery store would like to go out to eat. They're still looking at that bill and doing a double and triple take. So To me, those are the issues, right? It's the, as I forget what president was, it's the economy stupid was the saying, right?
Yeah,
That's
Clinton.
what, and that's because that's people's ability, right? To feed their family, to pay their rent, their mortgage, to feed their kids, to afford childcare. In my experience, that's what people care about, and that's what we should be focused on. And we're doing a lot of good things. I think that tax break was really
Mhm,
tax package, I should say, was really
mhm,
really important. It got
mhm.
a lot of these issues, but the work still remains. And then yesterday, you probably saw we had this really big, the governor filed a really big veterans package, the Hero Act, and that on the heels, obviously, certainly for folks in Westfield and beyond. There was a Navy SEAL, Chris Chambers, who was one of the two who are presumed dead right now, missing from that incident in the Aden Sea from a week and a half ago. So just again, another example of the sacrifice of our service members, right? Like every now and again, something happens and it hits close to home where that potential sacrifice that military service could entail kind of smacks you right upside the head. And it did for the people of Westfield and Massachusetts and beyond, right? It was one of our own. So that's why we do what we do, right? Like when we hear a bill and we have the governor testify yesterday, it's like people like the Chris Chambers of the world and the countless others who have lost their lives and who are serving, why we need to continue to do what we do. Because a real concern I have is that if a young man or woman is contemplating joining the military, and if we're not seen as a society that values that service, that's going to weigh on that young man or woman and whether or not they decide to go through with signing the dotted line. And that's, I said this yesterday at the hearing. One of the biggest concerns I have in 2024 is a concern I had in 2023, was the record low numbers of folks signing up for the military. It's the
Yeah,
biggest problem people are not talking about.
yeah, yeah. I agree. There is there's too much like pomp and circumstance regarding veterans and not support.
I love that. I
Um,
like that. I'm going to use that.
yeah,
I like that.
yeah, and the for people who want to sign up, that they can find a way to get the skills, that they get them skills that they can continue then to lead lives with opportunities for them. But also, a lot of people are just sitting on their hands and not volunteering for anything, Senator,
Absolutely.
not to be on a town committee or a city committee. They don't want to give up even 2 hours of their time. So then to ask them, maybe you have to put your life on the line. That's a big ask. And I know you've done it, and I know other people have done it, but most people, as you have just said, do not do that. If the senator looking into 2024, seeing that the projections that the governor and her team thought there was going to be all this money, and now it's like, whoa, let's pull back some. What are some of the, do you already know what kind of projects that you need to, okay, I'm going to just focus on these because the other ones we're not gonna get enough signatures on them
Yeah,
or
I mean, it's
funds
tough,
even.
right? It's, one of the hardest parts, we hear all the time from constituents about different programs that are out there. It becomes a little more challenging when you have one of the votes that determines what actually gets funded and what doesn't. And that's never an easy thing because invariably what happens is programs that really matter and in many instances save people's lives, housing, substance use beds, those are the programs that get cut. So the financial picture is bad, but it's not awful. I want to be very clear. It's not awful.
Mhm.
And I think we need to be cautious about how we describe it because I don't think we should be painting a picture that the sky is falling, i.e., 2008. Right? We're not there. I'm not saying we can't
Mhm.
get there, but I'm saying we're not there right
Mhm.
now. So I
Mhm.
think it's just tightening up the purse strings. Right? It's one of the things I always say that people forget is that the main difference between state government and the federal government is that it's the equivalent of state government. We use a debit card, whereas the federal government, they use a credit card. They can just print money. They can put thing on their credit card. They can say, I'll pay it years from now. Whereas we can only spend what we have. So when
Yeah.
revenue's not coming in at levels that we had hoped to come in, that means that we're not going to be able to spend as much.
Yeah.
But I think there are some areas that, that's out there. I mean, look, let's be honest, the emergency assistance program right now, and that's the housing program right now. We've got a challenge going on right now in Massachusetts where this unanticipated cost, right? Like the quite frankly, the migrant crisis that's going on right now, where folks are,
Mhm.
coming from the most horrific circumstances in the world, and they're ending up in Massachusetts. And Massachusetts instincts are to be compassionate and to be caring and all of that stuff. It's one of the things that makes Massachusetts great. The flip side of that is that it's using a lot of money, and it's about balancing, right? It's so what I would say is this: 2024 is going to be the year that we have a lot of really critical, important discussions about what are the things that we absolutely need to fund, and what are the things that we can say, look, this is what we can spend on this program, but nothing more. So there's going to be some very
Mm.
difficult financial debates in Massachusetts this year.
Is there
They're already
anything
starting.
that is there anything, say, that you're thinking, and your colleagues may be thinking, but especially you, that we may have to go down a little bit in funding on in general topics? And I hear you say about mental health. I hear you say about the housing and the crisis of so many people not having a place to live. Uh, People, you can have all the warming places, shelters in the world, but like as you said, if you don't have enough staff for that, then it doesn't make a difference. Um, Pardon my colleague. I'm gonna have to cut this out.
No, it's all good.
Right. Okay. So is there something that we may see a decline in, because we have to be realistic? Should we be bracing for something, whether that be less money for education, less money that comes back to the cities and towns from
Too
taxpayers?
early, too early to tell. The governor today released her FY 25 budget. The House will take up the budget in April, and we will take it up in May. So the benefit of going last is you have the most time to look at revenue numbers. So we in
Mhm,
the Senate, we have till May to kind of look at tax revenue, see where all the,
mhm,
and that's one of the interesting things about this, right? We know that people still are out there spending money.
mhm,
So we could see, I mean, it's not beyond the pale that by the time we get around to doing the budget, that those revenue numbers could be better than that they are today. So
mhm.
I think it's fair to say that it's too early to tell you. But assuming that they stay stagnant, if you will, I think the issues that I would make the case, we really can't touch are things like housing, workforce development, behavioral health, um, and all things that kind of fit that rubric of how do we continue to have Massachusetts be a competitive place where people can afford to live here. Things that fall outside that bucket are likely the things that you will see get hit, because we know we're at a crossroads. We're at an inflection point in Massachusetts where we're either going to be competitive or not, because we
Well,
have data that tells us people are leaving. And if we want to reverse that trend or kind of halt it, arrest it in its place, there are certain things that I would argue need to happen. Um, so,
yes.
so in one of our next conversations, I will certainly have a more clear picture on that.
Okay. Yes, Massachusetts has been trending in losing population, but offset by people, immigrants from other
Yeah.
countries coming to Massachusetts. I not always with the the skill sets that pay good livable wages though.
Yeah.
And so that is also then reflected in the tax base. And
That's a really brilliant point, and that's something that's lost on a lot of people. And the only thing that I'd add to that too is that many of these immigrants who want to work can't work because the federal government's telling them they can't work. And I'm one of the believers in this school of thought that says, look, we've got this whole pool of people, if you will, that are here that want to work. Why not get them working, which helps them get out of hotels, get into apartments, contributing to the tax base? And oh, by the way, we've got a workforce crisis in every industry. These are bodies to fill those positions. So, and these conversations are happening. So I don't want to suggest that everybody is rejecting them. They're happening, but I think government needs to get more nimble at looking at what is a challenge. And by all accounts, the migrant crisis is a very big challenge right now. There's no way to dispute that. But let's what's that saying? We in government need to get better at turning lemon into lemonade, right? Like there are some really
Mhm.
good things that we could be utilizing and leveraging in this. And again, this goes back to my time when I was on orders with the Army in response
Mhm.
to this.
Mhm.
The number of people, everyone I spoke to that were in that population, with me, it was the overwhelming majority of them were from Haiti and then Venezuela, and
Mhm.
having conversations. What's going on? What's in your mind? We want
Mhm.
to work. We want to work. We want to work. And I think that's lost a lot in this conversation. I think there's some folks who might, maybe not, but think that these people who are there like being at a hotel sitting around not doing anything. Nothing could be
Mhm.
further from the truth.
No,
Nothing.
no,
And I saw
no.
that with my own eyes. I don't need
Yeah,
to read a report. I saw it with my own eyes.
yeah.
And that's my story, and I'm sticking to it, my friend.
I'm sticking to that story with you. I've seen it also with my own eyes. There's no joy in
None.
not having your own place. There's no
None.
joy at all.
None.
No, no. Senator, thank you very much for your time.
We'll talk to you, my soon. We'll talk to you soon, my friend. Stay blessed.
Okay. All
God
right.
bless.
Thank you. You too. Bye.